Hello, today we are presenting our analysis on the Affordable Care Act tax credit expiration. So we're going to go over the background, some impacts on stakeholders, and the future implications and conclusions. Starting with the background, the Affordable Care Act was implemented in March 2010. It was intended to subsidize health insurance for households within 400% of the federal poverty level, to expand Medicaid coverage, and also to increase health and care innovation. It was successful in decreasing the uninsured rate significantly, as shown in Figure 1. Now, in the present, there's been an issue because these aforementioned subsidies were implemented through enhanced premium tax credits. They had an over 50% average decrease for over 20 million enrollees in their premiums, but those PTCs expired in January 1st of 2026, and this left 4 million projected to become uninsured due to increased premium costs, as shown in Figure 2.
Now we have the impact on stakeholders. This table is an overview on relevant stakeholders and how this decision impacts healthcare providers and the overall U.S. healthcare system. With the expiration of the expanded premium tax credits under the Affordable Care Act, lower and middle income policyholders are the most impacted. Many face higher premiums, some may lose coverage entirely, increasing the uninsured rate and creating a sicker insurance risk pool. Hospitals and clinics are next, as they absorb more uncompensated care, leading to revenue instability and operational strain. Small businesses are also affected because employees may lose affordable coverages, creating pressure to raise wages and or manage productivity challenges. Finally, nonprofits have faced increased demand for healthcare assistance, placing additional strain on community resources.
Here we have the three most affected stakeholders, starting with marketplace enrollees, which constitutes mainly of low and middle income people, with 22 million people receiving enhanced premium tax credits and will see their premiums double or more if they expire. 10.9 million individuals could go from paying $0 to up to 4% of their income, and this will cause a rise in household financial instability. Next, we have 4.4 million of small business owners who will lose around $1,500 due to the credits expiring, having to focus their business to drop coverage or shift their costs. And finally, we have hospitals and clinics. With increased uninsured patients will lead to higher uncompensated care and a lot of bad debt. And providers will shift costs to private insurance, contributing to further premium increases.
Other stakeholders that would be impacted are health insurance companies. As premium tax credits expire and enrollment declines, the risk pool becomes more sick on average, increasing claim costs for insurers. In response to higher claims and uncertainty, insurers raise their premiums. As coverage shrinks and premiums rise, providers will experience more uncompensated care. Federal and state governments are also going to be impacted as private market instability grows. Governments face pressure to intervene through Medicaid expansion or reinsurance programs. Regulators must then balance their insurers rate with consumer access to affordable care. The last stakeholder that we'll talk about is the U.S. economy. As premiums rise and coverage declines, households have less disposable income, reducing consumer spending. Over time, with the poor population health and increased public healthcare spending, it will create an economic strain.
Okay, the three parts about future impacts. The reduction in insurance coverage weakens the risk pool, which may further increase the prominence for those who still have the insurance. Estimate 3 to 5 million Americans may lose their insurance. From long-term impacts, we say the older population health may reduce workforce productivity and increase the disability rate. So this can increase the government spending through programs such as the medicine and disability benefits. Yeah, that's all.
Thank you. And here are references.